Hey guys, Dr. Wander, Integrated Health Center of Maryland. Today we had a couple patients come in. One was a type 2 diabetes patient. The other one was a thyroid patient. And both of them is very interesting. With the diabetic patient, it was a male. And I hadn't seen this gentleman for about 3 years. And he came back in, and I recognized him, obviously, and he came in, he said, I came in 3 years ago, and I wasn't ready, so you didn't take my case, which was the proper thing to do. I didn't take his case. We don't take all cases. And I said, well, what's been going on the past 3 years? And he said, well, the first 6 months after I had met with him originally, he had gotten way worse. And I was like, well, why didn't you come in during those first 6 months? And he was like, I was embarrassed that you didn't take my case, and I was embarrassed that I wasn't ready, and I was embarrassed that I wasted your time, and I just didn't want to come in because I was embarrassed. And then I said, well, what made you come in now? And he's like, well, I got over the embarrassment because my A1C just kept climbing higher and higher, my cholesterol kept climbing higher and higher, I was on more meds, and my doctor threatened me with insulin, and I definitely didn't want to go on the insulin, so I said, I don't care about my embarrassment, I was ready, and I want to go in, and I actually was able to accept his case. Now, the moral of the story is, these two patients can't be the only patients out there that I've met in the past, whether it be a month ago, a year ago, 6 months ago, 6 years ago, 10 years ago, whatever the case may be, who we didn't take your case for whatever reason, and you were thinking about coming back, but you didn't because you were embarrassed or some other reason. So I'm just here to say, if that is you, and for some reason we didn't take your case, do not feel bad. I will not make you feel bad about it. I will not say I told you so. I will not say, oh, you should have came back earlier. I will then, if I'm able to, accept your case at that point, and we can start the process of beginning to reverse and handle your condition. Thank you.